I'm Dr. Olivero. I'm the medical director for Region STEM and for Show Me Younger Aesthetics. We're working in conjoint efforts to give you an educational series. And today we're going to talk about the difference in between PRP, platelet-rich plasma, and stem cells. It is, on the first one, what is PRP? Platelet-rich plasma. We extract some of the blood from your veins. We actually get in a centrifuge, we spin it, we hyperconcentrate the platelets, and then we stimulate them to release some of the granules that are inside the platelets. The effects of this one is an anti-inflammatory, antibacterial effect, which actually works great in reducing pain and reducing inflammation. So that can be used actually for joints, larger joints, smaller joints, or also it can be used actually for aesthetic purposes. Whenever people actually have like a rejuvenation of the face, to reduce some of the inflammatory signs on the face and stimulate your collagen and elastin. So the first one is PRP. Now the second one I want to talk to you about is stem cells. On the stem cell side, we have very small embryonic stem cells that we actually get it from your venous side. We centrifuge it again. We get it through a process where we're incubating, creating cluster differentiation on the cells within 24 hours. And now these cells actually can be used actually for intravenous use, or they can be used actually for soft tissue or for aesthetics as well. So that's a fantastic way of getting it. This one favors more the young, but it can also go to all ages. Most of the people like to get higher concentrations of stem cells. The other way to get it is actually by getting it through the bone. Where are we getting it? Actually through the bone. Through the bone marrow. We usually get it through the iliac crest. This is a way where we numb up the iliac crest and extract the stem cells from hematopoietic type of stem cells. In these ones, we're getting higher concentrations than your intravenous, and that allows you actually to do more healing into the joints, into the soft tissues, or even for aesthetics, which is fantastic. The effects are great. Then we have another one where we're actually getting the same effect, but we're getting from Whartons Jelly. On the Whartons Jelly, those are the ones that come from the umbilical cord. These are not autologous, but they are great actually for healing. They come from donated umbilical cord. And what they do, they have a certain amount of stem cells, and they also have a certain amount of growth factors and cytokines, which actually help in the same way for your joints, soft tissues, and for aesthetics. There's a lot of regeneration on these methods with stem cells. Stem cells regenerate and they restore your tissues that were in a way damaged. So it's a great advantage. And now, the one that I like to focus the most is actually stem cells from your fatty tissue. We don't call it fat anymore. We call it like liquid gold. Why? Because from the liquid gold, actually, we can extract with a lipoaspiration, we can extract so much stem cells from that area, mesenchymal stem cells, that we can achieve 500 to 600 times the stem cells that we had before. That will allow us to put like multiple joints, multiple places once we actually extract your stem cells. That will benefit when people actually have multiple areas of injury. And not only that, but the results are better. People compare to bone marrow, because most of the studies are there, but the efficacy of the fat stem cells, fat-derived stem cells, is fantastic. We do a lipoaspiration with a minimal incision, and we give a regional block and tumescent anesthesia. So you feel less pain, and it is very tolerable procedure. Now, In comparison with the others, this one is fast. We can process it in between 2 to 3 hours, and the results are fantastic. You're gonna start seeing the response within 2 to 3 days, all the way to 6 months. And the results are lasting, more lasting than other types of stem cells. In my experience, I already had in both my knees, my joints in the ankle, my back, and my TMJs, I already had stem cell recruiters. That helped me improve function and decrease pain. But once I have my own stem cells derived from autologous fat transfer, from my own fat, my own tissue, that I was guaranteed that I will have like less side effects because it's my own, and I didn't have to worry about any the samples of the patients from donation to be vaccinated or not vaccinated or any type of antigenicity. I didn't worry about that. I got it without having that worry in my mind, and I know it's my own tissue. I couldn't ask for something better. So I loved it. Not only that, but I started getting more functional. I was limping with my right knee, and I used to have like more of a disability on that end. And now I'm able to move faster. I'm able to do more activity. I'm able to enjoy life with my kids. I'm able to attest for the adventurous life I'm getting back into. I was missing a lot of years of my life and a lot of joy in my life, and now we're actually allowing for this to go at a lower cost to you. We're giving you the best technology at affordable prices, so you can actually consider this as a therapy for you or your loved ones. Thank you for watching. I hope you like this video. Give us a like if you like the way we actually approach this topic, and we welcome your feedback. Thank you.